Beyond that, I'm able to go privately anywhere within 6 hours of my home. I live in Middleburg. That gets me to South Carolina, Atlanta, Pensacola, Miami. I'll go anywhere if people need help, especially if they want to pay me privately to do that. It doesn't do any good to let people know that you're on the floor. I have patients all the time that are like, well, I live with my kids. I live with my daughter. So that's a good thing. And I'm like, you might as well live across the state. It doesn't matter. If you don't have a hold of somebody who is a fall risk, they're still going to fall, right? Having notification that somebody has fallen, I mean, personally, the Apple Watch, because it has an automatic notification. There was a lady that was at the meeting the other day that has a watch that's supposed to notify people and all of her caregivers and everything. I'm sure we're going to see these things popping up everywhere. Yeah, I mean, we're much better off preventing the fall, because the problem is if that person falls, like this lady I'm going to see this afternoon, her care, the amount of care that she's going to require for this spinal cord injury, if they would have taken any ounce of care or concern for the fact that she had all of these medications on board, if anybody would have paid attention to that, it would have taken much less time than however long she's going to live with this spinal cord injury and a family member having to turn her and prevent her pressure wounds and everything like that. I want you to think about this. The lady that I'm going to see this afternoon, she has kids, she has grandkids, she has a husband, she has other family members. All of these people, they have probably told her or other patients and clients that you guys work with that you need to take up those rugs, right? But if it goes in one ear and out the other, because there's no follow-up behind it, if there's no resources behind it, if there's no point of reference, right? When I go in, I tell them you need to take up the rug, but why is the rug there in the first place? Oh, well, when I come in from letting the dog out, I don't like getting my feet all wet, right? Oh, well, okay, so let's do this. Instead of having a rug that's a trip hazard, why don't we do this? Why don't we have somebody come in and do some epoxy coating right on the entrance to the door so that the mat's not going to move, right? I mean, we can't stop the lazy foot, right? You're walking through Publix, the tile's not sticking up, there's not a can of pickles in the way or anything like that. You just trip over because you're not picking your feet up. You can't stop that. That's why we tell patients that you can't be looking at your feet when you're walking around the house. You need to be looking up. If anybody's ever ridden a motorcycle, your body goes where your eyes are pointed. If you're looking up, then your body is upright, your toes come up. If you're looking down at your feet, I promise you, if you stand up, whenever we're done with all of this, and you look down at your feet, you're going to feel your body weight go towards your toes. And we wonder why these patients drag their feet. And then they're wearing flip-flops or Crocs or slides or whatever you want to call them, right? And all they're doing is curling those toes trying to keep them in the shoes. If we teach these people to stand up, which that's what skilled therapy is for, and we get the rugs that are a trip hazard out of the way, the ones that are a slip hazard by putting epoxy coating down. Next to the sink is another place where everybody wants a rug, right? You put some epoxy coating there by the sink so that the floor doesn't get wet. Right outside of the shower is another famous place, right? You don't necessarily need that rug there, but if you want that rug there, let's put something down so that rug doesn't move. The rubber backing on the back of it just makes it thicker, which means that it's a bigger trip hazard. We can go low profile with these mats and put something on the floor so that they don't move. So just so you know, like John was saying, if you have somebody, I'm gonna provide you with business cards. I have STEADIs if you want them that has our referral information on the back. If you call us, if you call me or you call Jackie and you tell them, hey, we've got Mrs. Smith is willing to have you come into her home, then we're going to do the legwork. We're going to contact the doctor. We're going to go to the doctor and say, Mrs. Smith wants an order so that we can go into the home. Don't you think that benefits everybody? Because then the doctor's like, holy cow, I didn't even know that you guys existed. I don't have to shove a donut in their mouth to get them to pay attention because I actually have a patient that we want to help, right? So we go in, we do the assessment. We provide everybody with the pertinent information. If you have caregivers going in the home, then your 4 hours are protected. They're not going to fall in the time that you're not there. If you're not there 24 hours a day with your hands on these patients, they're still going to fall. There's a reason why you're there. No, there's Medicare A and Medicare B providers out in the community that I am more than willing to refer to. When we go in and do the assessment, a lot of times when we send it back to the doctor, we're like, hey, we're recommending all this stuff in the bathroom. Why don't you write a specific order that says the OT needs to be in there for 6 visits, not just letting a physical therapist decide that the patient doesn't need occupational therapy. Our prescriptions for all of our pills have a dosing schedule on them. Take 1 pill a day, 1 pill every 6 hours or whatever. If you could just take a pill whenever you felt like you needed a pill, we'd have a lot of really sick people. But this is what the doctors do when they send an order to a home health company that says evaluate and treat. It's like leaving the fox in charge of the chicken coop. Well, we get paid for 16 visits, and I got a paycheck to make, so guess who's going to be doing 16 visits? It happens every day. So what we do is we make sure that there's a specific order for specific things that need to be done. And then the patient gets that 6 visits with the OT to work on that transfer and using that shower chair and everything like that. Thank you very much, guys. I really appreciate it.